Hello there, it's time for another anatomy lesson. Today's topic is skin glands. So it's probably going to be all you ever wanted to know about sweat and more. So let's get started. Exocrine glands. Exocrine glands are glands that secrete substances out of the body. Okay, out of the body. Exit, exocrine. So we have sweat glands. Let's talk about it. They're also called sudiferous. Sudiferous. Great word, sudiferous glands. So instead of saying sweat glands, you could say sudiferous glands. And there are two types. They're eccrine or merocrine and apocrine. Okay, two categories of sweat or sudiferous glands. So what is sweat anyway? Well, sweat is made of mostly water, but also urea from the breakdown of protein. It also has salts, which is why if you've ever had sweat drip in your mouth, it does taste salty. Note, we have about 2 to 4 million sweat glands on our body. That's a lot. All right, let's talk about eccrine or merocrine glands first. They're the more numerous type. They produce clear, watery sweat. They empty into pores on the surface of the skin. Okay, so right here, I show you, this is an eccrine or a merocrine gland. Okay, it is producing sweat and it's going up and onto the surface of the skin. So directly onto the surface of the skin. Its function is to cool the body. That's a really important function. So where are they? Where are eccrine and merocrine glands? Well, they're mostly on the palms of our hands, the soles of our feet, and our forehead. So it's why if you are nervous, your palms get sweaty, okay? That's where it's going to get sweaty first. Also on your forehead. Your forehead is important. It's kind of like your brain cooler. Your brain is very sensitive to temperature changes, so it's going to be important to keep that cool. Where are the eccrine or merocrine glands absent from? Well, the borders of your lips, your nail beds, your external ear canal, and the clitoris and labia minora. So other than that, you got sweat glands, specifically the eccrine or merocrine glands. Now what about the apocrine glands? Well, the apocrine glands actually develop during puberty. They produce a thicker sweat that's mixed with fat and protein. And this is the important part. So here, again, if we look at over here we have the eccrine merocrine gland that we just talked about, opening to a pore directly on the surface of the skin. Here we have an apocrine gland, and it opens, if you see, into this hair follicle, not directly to the surface of the skin. Okay. So they empty into hair follicles. This sweat is often yellow, remember, because it's not that clear watery sweat. It's a little thicker and it's got fat and protein mixed with it. And the function of this is, well, a lot of people don't really know, but it really contributes to our body odor, our body smell. What happens is bacteria love this thicker sweat. It's got fat and protein mixed in, and the bacteria digest it. And as they digest it, it produces our smell. Now, where are apocrine glands found? Well, they're far fewer in number, and they're found in these specific areas. The axillary, okay, your armpits, the inguinal area, your groin, and around your nipples. So really the primary function is producing body odor. And again, remember, these apocrine glands don't develop until puberty. So sudiferous glands are sweat glands. Eccrine glands, that's the sweat source, that's to cool us down. The apocrine gland, that's the smell source. That's what produces body odor, and those get released into hair follicles. Now, we also have sebaceous glands. Sebaceous glands also empty into hair follicles. They're found all over, except on the palms and soles. They produce oil or sebum. And the function of that oil or sebum is for waterproofing. It's important for our skin to be waterproof. It also serves some purpose in inhibiting the growth of bacteria. So, 3 main glands in the skin that we've covered so far. We have eccrine, sweat glands. They produce a cooling sweat. The apocrine sweat gland, they produce the body odor sweat into hair follicles. And then we have these sebaceous glands that are going to produce sebum that are responsible for some waterproofing protection as well as inhibiting some bacteria from growing. Now onto 2 specialized glands that we're going to talk about. All right, so first we have ceruminous glands. All right, so ceruminous glands involve just your ear. That's it. Ceruminous glands are found in the outer 1/3 of your ear canal, so just in your ear canal, but just near the end. They produce earwax or cerumen to trap invaders. So ceruminous glands, they produce your earwax, and it's to help trap anything that might get into your ear. Has a purpose. And then we have mammary glands. Mammary glands are located in female breast or mammary tissue. They produce milk. They are enlarged and modified sweat glands. Okay, so they're larger and they've sort of been fine-tuned for this process. But sometimes things go wrong with glands. Let's learn about some of the imbalances. We have acne. Acne is an active infection of sebaceous gland. Okay, that's the white stuff is pus. That's telling you it's an infection. So more about acne. Some causes of acne can be from overactive oil glands, genetics, unfortunately, hormones, menstruation, stress, some medications, and some foods like grains and sweets. They've been found to play a role. Treatment for acne involves gently washing the affected areas. Okay, so washing your face daily, morning and night. Use of over-the-counter medication. That is what most people can treat their acne with. For more severe acne, dermatologists can use oral antibiotics or can use other medications. Now, there are whiteheads. Okay, these little things. The whitehead means a duct of a sebaceous gland got blocked and closed by skin. So see here, actually, this duct, the opening is blocked by skin, which is why it appears still white. What could it be blocked by? It could be blocked by sebum. It could be blocked by dead skin. Whatever the reason, this sebum underneath, okay, is clogged, and we're seeing this in these little white dots, okay? It can also be blocked by dirt, okay? But again, it has a white appearance, okay? So that duct is closed, and we're seeing blackheads. The duct of the sebaceous gland got blocked, but it's open. So see, it's not closed by skin. So what happens is the sebum oxidizes, darkens, and it still involves a block or clog or plug of the sebaceous gland. We're seeing oxidized sebum because it's in contact with the air. And then we have seborrhea, cradle cap. And that's overactive sebaceous glands in infants, and it kind of produces this crusty appearance on babies' scalps. Okay, usually babies outgrow this relatively quickly. And there you have it, your skin glands. Probably More than you needed to know? Well, not more than you needed to know for me, but maybe more than you wanted to know. All right, so sebaceous glands. Our next topic, something else in the integumentary system. So stay tuned.